Back to that situation with our hospitals, the state activating a crisis plan which could determine who gets what type of care if the resources are scarce. ABC 15's Mike Pelton live outside Banner University Medical Center for us tonight. And Mike, you talked with a nurse who sees this daily reality firsthand.
Yeah, and Katie, he tells me they are getting busier and it is putting a strain on resources. He tells me not only are they seeing an increase in the number of patients coming in for help, but some of those who have COVID-19 and survive remain in the hospital for weeks or longer.
There's a lot of people that are also now coming in and they're not doing well from the moment they get in, and it's only a matter of time before they're requiring either oxygen or ventilators.
Nico Sandstedt is a nurse at Banner University Medical Center in Phoenix.
It's a strain on everybody because it's not just nurses, it's the doctors, respiratory, pharmacy. Every part of the hospital is kind of now feeling the strain of what's going on.
And on Monday, the state allowing hospitals to activate their crisis standards of care plan, which includes a scoring system that could determine who gets what type of care inside a hospital.
It gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those. The other thing that it does, though, is it also gives their healthcare workers some liability protection as well. So not all of our hospitals actually meet crisis standards of care just yet. So it was a proactive step by our hospital.
It's one of those things where I think they kind of compare it to like war zone nursing, where it's kind of like you're triaging and you're just trying to keep people alive at that point.
Nico says prevention is now the biggest tool in slowing the spread.
It was almost like in Jaws when they opened the beaches too early, and then now you're having all these, it's like the cases kind of exploded on us, and it's kind of what we thought was going to happen in April, but now it's happening in almost July, and we're seeing this steady increase where it's not stopping. Now, in crisis standards of care, patients are scored on a variety of factors, including how long they're expected to live if they survive. Now, for those who need critical care resources, they are ultimately placed into one of three categories: highest, intermediate, and lowest priority. For now, we're live in Phoenix tonight. Mike Pelton, ABC 15, Arizona.